Hey, what's going on, good people? It's your boy James Harris, of course, Mental Heal. Listen, I appreciate all the support over the years, whether it was for my book, man, Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. So salute to those parents who got it for their young sons. Praises to those partners and couples who got it for the men in their life. Of course, to the schools, the administrative, and everybody else who ordering the book by the dozens. I definitely appreciate that. And also salute to everybody who supported me on Cheesy Date Board Games, which is a good game for adults and couples, your game night, your date night. So many interactive ideas come from it. I definitely love the responses that it's garnering. But now I'm asking for your support again on this YouTube journey. I'm back. I took a little break because I had so much going on, but be a little bit more consistent with it. I got a couple interviews lined up with prominent people and people doing phenomenal things within the community or within this mental health space or even different authors and things like that. So bear with me. Appreciate your support. So make sure you like, share, and subscribe. And the guest that I got coming up now is.
Yes, I'm Timothy Silver, a physician here in the Richmond area. I'm a member of Omega Psi-Phi, and James is one of my chapter brothers. I'm here to talk about some basic health tips for men in the community.
I appreciate you coming, take your time. Specifically, when we talk about numbers, I know right now prostate cancer is one of those hot topics. Um, so overall, I guess you can start there and we can get into what the numbers are and all those things.
Sounds great. Um, this goes back probably over a year now. I've been trying to work on a campaign called Know Your Numbers, and the basics or the basis of it was to help with the general awareness of how these numbers can help you stay alive and stay healthy. Um, and to make you a self-advocate when you go to your doctor, you have numbers, you're aware of what the conversation should be. And so when I talk about know your numbers, yeah, sure, we should know our vital signs. Those are the basic numbers. That's your blood pressure should be around 120 over 80. Just a little wiggle room in there, but not too much. The temperature should be 98.6. That's 37 degrees Celsius with some wiggle room and some variation throughout the day. Respiratory rate should be from 10 to 16 breaths a minute. Um, and pulse should be from 60 beats a minute to about 100. Anything over 100 needs to be looked at, particularly if it's sustaining over 100. There is some variation with the 60, the bottom number of your pulse. If you're an athlete and you're doing a lot of cardio, it's not uncommon to have your heart rate in the 48 to 50 range. I think Michael Jordan's classic heart rate was 48, which caused a stir every time he had a physical. But that's normal for him. His cardio was that elevated. So my next set of numbers that I think we need to look at is the obvious your cholesterol. What do those numbers mean, and where should they be? And some dietary choices. That could be another talk that we could have, but that's a very important one that we can gain power with. The other is diabetes, knowing what your hemoglobin A1C and what that really means, and how you can monitor your blood sugars to keep from having what we call end organ damage. What most of the men don't know is that every time their blood sugar is over 200, there's cumulative damage being done to their end organs. And when I say end organs for diabetes, it's mostly the blood vessels, the nerves, because they have small blood vessels that supply those, the kidneys, um, and brain and eyes. You've got macular degeneration. All those are because those blood sugars were consistently high and creating an osmotic gradient. If you remember osmosis from high school, you're shifting water through a semi-permeable membrane against the concentration gradient. Well, that sugar load makes a concentration gradient that shifts water very rapidly, and that over time causes damage in small vessels. Then we get to the prostate. Now, the reason the prostate is important is because um, there's some variation in the way it's being taught in medical school. And when we get to public health, the standards say that we should start checking for serious prostate screening at age 50 to 55. Well, what I found out in practice is that the black men particularly may have a more aggressive form of prostate cancer when it shows up. And so my thought is they should be getting PSAs and digital rectal exams from their 40s on up. The most aggressive types of prostate cancer will come on at an early age and it'll be very aggressive. And we lose folks more rapidly. Now, the statistics that are kind of setting the standards for the insurance companies and the ones that regulate how we screen our health in public are a little bit shifted because it's based on white males. So with black males, we need to pay out of pocket if need be to get a PSA test done if you're 40. Now, the digital rectal exam is a very good tool. If the doc finds some lumps or bumps or sort of enlarged prostate, they can address it. They can order a PSA. But it's nice to have that baseline PSA um, because it can get early detection, early treatment, and resolution of the entire problem. Um, and that's kind of mine was detected early. I'm a survivor of prostate cancer. And it's because the PSA was detected so early, kind of because I pushed for that, that we found it, got it removed, and been cancer free since, at least from that area. So there is some value in knowing that number. The PSA is prostate specific antigen. It's a protein that's secreted by the prostate gland, and it's detected through a blood test in the lab. Um, Digital rectal exam is exactly what it sounds like: finger in the rectum, through the anus and to the prostate, and the doc will measure the size with his fingertip, usually. So now, what's the if you kind of do some research on it, some of the sites will say that, well, we don't want to check too early because it can lead to false positives, leading to false biopsies. And I say hogwash. We got too many young folks, young black men dying of prostate cancer. You know, I would gladly have traded some of my colleagues that I know that are no longer here a false positive biopsy, and they sit on an air donut for a couple of days just to make sure to say that, hey, you're good, right? So I think the standard in the community is not supporting everyone equally compared to the relative risk and the risk of dying from it. And that's why I'm pushing this as part of Know Your Numbers campaign.
Yeah, so I appreciate it, man, and that's why I got you here. One, you just educated us on so many different numbers, and then two, I think it is a difference between blacks being treated compared to European males, just based on historically, everything is not. I don't want to say necessarily catered to or dedicated to that white male society, but in this case, it's obvious and statistically, it's I guess proven. So I'm gonna back up a little bit. What is your experience? I know you retired military, and I know you're currently a practicing physician. So for the people out there who will want to know, like, is this credible? Can I rely on this information? Can you run down just your history a little bit?
Well, I've been a teaching doc at VCU School of Medicine, Department of Physical Medicine and Rehabilitation. And so I'm accustomed to writing papers and doing research. Um, these numbers and this promotion that I'm doing for Know Your Numbers isn't so much the research that I've been tagged to with the university. This is stuff that I'm looking at the community and seeing the need. And that's why I want, and it's not that you've got to go in and fight for your numbers and these types of things, but I want you to use these numbers and to empower yourself to take these numbers when you go to your primary care. Um, you know, I guess the big question is, why is there a difference in the Black population and others? Well, that really hasn't been answered satisfactorily in the science literature right now. They'll suggest that it's maybe cultural, maybe socioeconomic. But what I do know is that the Black males that I know with prostate cancer tend to get the more aggressive types. And we don't really have a marker just yet to determine who's going to be aggressive and not. All I know is that if you get a PSA bump and you're in your 40s, there's a chance that that needs to be followed closely. Now, it could be just a prostate infection, but most of the guys that I know that got cancer started off with the diagnosis of prostatitis, which is the infection or inflammation of the prostate, which will bump the PSA. So either way, it's worth checking and following quickly. And uh, my credentials for this is that I've gone through the process personally. Is my not only my focus, but it's my impetus for wanting to spread the information to others.
Yeah,
Is that
appreciate
helpful? Does that answer that question
definitely
in a
appreciative of the
roundabout way?
information. So for me personally, man, I'll be 40 next year, and I'm not necessarily dreading scheduling my appointment for it, but I definitely am. So I'm one of the people who go to the doctor twice a year for physicals and checkups and stuff like that, and in between if I need to. So I'm more of the cautious side of things, just based on I want to be here for my girls and my wife and my community and stuff like that, opposed to having some creep up on me. So how can I or other Black men prepare for this prostate exam? What does it look like preparing for it, leading up to it, day of, post exam, and all those things? Because I think, based on the research that one would do on their own or the rumors that they heard, it's more so of, hey, you're gonna be in that gown with your back out. The doc will come in with those gloves on, and so that fear gets into a lot of men mind, and that's why potentially they don't go, or they, have reservations about it and put it off. And then, of course, potentially it's too late. So, can you walk us through what does it look like leading up, the day of, and then, of course, post exam for prostate?
Yes, I can. I can do that. Let's start off though the because you hit on some really good points that are sticking with me. The fear of going to the doctor. You're clinically in tuned. And if you're feeling stress about going to the doctor for any reason, you still go because you're clinically in tune. What if it's a friend of yours that's totally not as clinically aware and just wants to avoid any new diagnosis? It may be a new medication, it may be new expenses. There's so many socioeconomic barriers to keep Black males from going to the doctor on a regular basis. So, rule number one, get a primary care doctor. If you don't have one, get on someone's list. Um, if you don't have insurance, there's a couple of free clinics that will kind of get on their list. So, number one, you need a primary care doctor that's willing to follow your health going through. The second thing is if you're prostate specific. Let's say you have symptoms. Your urine stream changes. You have pain when you urinate. Some of the same things you would see with a urinary tract infection in males could be prostate. And so you go get that checked out. The doctor will do a urinalysis and they'll see if you have that. They may even treat you for prostatitis. But the digital exam is not that big of a deal. It's you're in the exam room. Um, I tell them to, I explain exactly what we're going to do. So there's no surprises. I talk them through. My hand is on your back. I'm going to use this hand to do this. And it's a lubrication. It's a fingertip, goes in, and I'm sweeping over the prostate. All right. So there's no way to prepare for that as a guy. I'm just telling you. It is what it is. The less you think about it and just go do it is the way to handle that from my perspective.
Got you.
I, I may be weird about that, but that's what's going to happen. But if the more you think about that, the more you'll kind of have stress and angst and run your blood pressure up by the time you get there because you've been worrying about it all night.
So let me,
So if they find that there's an enlargement, or if they find an irregularity in the shape or the size, which is an enlargement, they may suggest doing a PSA. If the PSA is elevated the first time, they won't jump to a biopsy. They'll say, well, let's make sure it's not prostatitis. May even treat you with some antibiotics and see you back in a month or two. And if it's still elevated, then it's time to do a biopsy.
got you. So earlier you spoke of different providers saying, hey, you can wait a little bit longer or you don't need it as early. So what if you are one of those ones that's cautious and say, hey, I'm 40, I'm here to get on the list so I can get me a PSA or exam or whatever the case is, and they say, no, come back in 2 to 3 years. Like, do you search for another provider at that point or try to suggest that they do it? Or like how do you go about convincing them or like if somebody's getting this information, because everybody don't have it. Because if I go to the
Right.
doctor and say, "Hey, I want to get my cataracts checked or my eyes checked," and they say, "Oh no, you're not at the age," I'm gonna take them for that word. But talking to you and knowing other providers, they might say, "Oh no, you can do it at this age." But how do the people who don't have a you to say no, go ahead and push forward or find another provider? What should that person do?
So it's not so much finding another provider because this is all insurance driven. The insurance data suggests that they won't pay for the PSA until you're 50 or 55, depending on what your policy is. If you have symptoms, and this is where you need to be completely aware, if you have any changes in in the things we discussed that may look like a urinary tract infection, then you got to get the digital rectal exam and get the PSA if it's indicated. If you feel like you have problems that's not being addressed, it's mostly because insurance won't cover it at that age. And that's when I say you offer to pay out of pocket. That's $60 for that lab test or whatever it's going to be. May give you peace of mind that we've caught this early. And, you know, if you're having that discussion with your primary care and you guys have established sort of a rapport, the discussion can continue that, hey, this runs in my family, or this, I've seen this in my uncle and he went down quickly and he got it really early. How can I get this even if I have to pay out of pocket? They'll listen to that because that's a rational approach. But if you're going to patient first or one of the quick places just to go get checked because you think it needs to be done, they may not do it because it's an insurance thing. They may not be able to get paid for it. And so it's really important to have a primary care doc that you have established relationship with. You can always, if you still can't get it done and you feel like you need to have it done, you can go straight to a urologist and have an appointment with them. Um, like Victor Orton is one of the fraternity brothers that's at Virginia Urology that specializes in this.
Okay, yeah, that's good. Um, so let's just say somebody does have that diagnosis now of prostate cancer or just, polyps or whatever you found. What's the course of action now that they have this information, this insight? Hey, we caught it early, but now we have to do dot 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 dot. So what's next for that person?
So if your prostate specific antigen is elevated and it's seemingly staying elevated or getting worse, you need to go to the urologist, kind of like the one I just mentioned. We're very fortunate in this area, Richmond, Virginia area, that we have a lot of urologists that are very competent in this region. So it's pretty easy to get one, and they may even have walk-in clinics for this type of stuff. But once you feel like, or your doctor feels like that PSA is elevated, or you have a nodule or something, it's time to go to urology. In fact, me personally, if I had anything like that found on exam, I would go to urology.
Okay, got you. Appreciate that. So. in addition to all the numbers that you spoke of, one should have access to a urologist just to follow up. So speaking of those numbers that you mentioned earlier, because there's so many of those different things, whether it's diabetes, hypertension, prostate cancer, and so many other things. What are some tips or lifestyle changes that men can do to prevent as much as they can before they get to a certain age and or start feeling whether it's aches in the bones or just bloating or the foods that they're eating and all that? What are some other tips that men can do to reduce those numbers that you spoke of?
Yeah, there's some basic things that I kind of promote in my clinic. I mean, taking sugar out of your diet is really hard to do because it's so addictive. We did some functional MRI tests show that the center of the brain lights up. Um, that is really the center for addiction and dependency. Every time you have a load of sugar, it's very similar to the center where cocaine lights up. So it shows that there's a potentially addictive connection there. Sugar is notorious for that osmotic gradient that we talked about, but we have it in everything. It's in everything we eat. So cutting the sugar out of your diet as much as possible. For hypertension, no added salt. Our culture promotes adding salt to everything. So no added salt, and if that the next step after that is start looking at labels. Most of the canned foods have is loaded with sodium as a preservative, and that also affects your water balance that affects your blood pressure, your kidney function, and everything's connected. So all these things are really good habits if we're going to start some nutritional things. Um, the I think we're all fairly low in vitamin D, so taking vitamin D supplements is not a bad way to go. If your doctor decides you need to be on a statin, like for cholesterol, um, enzyme CoQ10 as a supplement that kind of helps that work more effectively in bringing those numbers back into balance. Um, the key is, use these tools to help you be a healthier person and be your own self advocate. And if you can use these things and show your doctor when you go to your appointments that these are the things I'm doing, then you're kind of partnering at that point. And I think you get better outcomes overall. If you go to a doctor's appointment and you go in there and they ask you all the questions they always do, and you say nah, and you just blow everything off because you're ready, it, you're not really communicating. You're setting the tone that you're trying to get out of there as quickly as possible. Well, they're going to get their $50 copay no matter what, which really doesn't go to the doctor. But um, the but you want to engage with them, show them some stuff, be active on your patient portal. If you see a specialist, upload those notes into the patient portal for your primary care. Connect those dots yourself. Don't count on them to do that.
Got you. Appreciate that. So for people, for men specifically who use substances, whether it's alcohol or marijuana or tobacco or anything higher than that, what are some suggestions you can do or make to them if they're not doing it responsibly or moderately? Because I know substances contribute to a lot of these health issues.
Well, it's cumulative. So the same things with the sugars. Alcohol is a big molecule. It creates an osmotic gradient that causes the same end organ problems if it's done too much. So, like, what's too much? If you look in the books, it'll say more than 2 beers in any given day, 2 glasses of wine, or 1.5 shots of 80 proof alcohol. That should be the maximum on any session. Um, Tobacco has no redeeming properties. Not even, I mean, it's nice to, I've got a lot of friends that are social with cigars, and you see me with one every now and again, but I don't really like promoting that because it is tobacco, and tobacco is really harmful to our systems. The marijuana is probably harmful if it's not medically prescribed and you're not sticking to the medical regimen. Anything in excess is going to tend to give you some problems. I'm not sure because we're still studying what the metabolic problems or pathologies from chronic marijuana use are, but we are seeing an uptick in the nausea and vomiting that you can get with marijuana overload, with THC overload. In fact, some of the emergency rooms used to call it the scromets, the scream vomits. They come in the emergency room doubled over, and it was strictly they need to cut back on their marijuana usage. Classically, as someone that's new to it and is eating edibles and smoking at the same time, and they didn't know what was going to happen with that, and they end up in the emergency room. So the key with any of those kind of things is moderation. Be your advocate. Don't overdo that. It's really hard on the system. And tobacco, you should probably cut that out completely, including the vapes. The vapes are probably more dangerous than we ever thought they were. They've got aluminum and metal byproducts that are getting into your system with the vaping process. Um, so I think that we should probably outlaw those, particularly in kids and young folks. But is that helpful?
Yeah, yeah, yeah.
That's kind of my approach to things.
No, I got you. I definitely appreciate that. So I've been in the field, mental health side of things for approaching 15 years now. And when I first got in, I recall doctors as well as other clinicians or psychologists, psychiatrists, thinking that the body and the mind were separate. But now we know, in this time, they go together, so you can have a mental issue and it leads to physical health problems. You can have a physical health problem and it lead to you to have mental
Yeah.
health issues. So can you touch on that a little bit?
The I mean, I've always been one to, even since medical school, to use the approach that mind, body, spirit are all connected. If you do, if you're not in balance in those areas, your body's going to feel it in some form or fashion, whether it's added stress, anxiety, those kind of things. Yeah, they're all really connected. Look at depression. If you go around with chronic depression, you get so many chemical changes that it starts affecting other parts of your body. And one of the classics is chest pain and palpitations, and you feel like you're having a heart attack. And they rule out everything. They do all the stress tests, they do all the calcium scoring, and it turns out your anxiety was doing that because your serotonin and norepinephrine were so out of balance that it was giving you physical manifestations to it. So that connection has been known and taught since at least my 20 years of teaching, 20 plus years of teaching in the medical university. But it's truly connected, and that whole sense of mind, body, spirit balance um, will, if you can grasp that and you come up with strategies, whether it's your meditation or yoga or however you're doing it. The only one's really been scientifically studied, at least in the last 20 years, has been Tai Chi, has shown to really make a connection with mind, body, spirit, and overall extending your life by doing that. So only because that's the only one that was studied early. So I'm sure any technique that you have will be beneficial. If you feel better from it, it's working.
I
It's
got you.
not going to be a mystery.
And I think one of the uh, minimized things that often overlook with the mind and body is gastrointestinal issues
Absolutely.
and joint aches, because the joint aches can come from anxiety or depression or even PTSD, and a lot of people don't associate that with mental health side of things. They just think like, "Oh, I must have slept wrong," or no, but specifically with the gastrointestinal issues, like you can have stress that cause those things, and a lot of people don't put those two as a connection together. So when you're in my session, we talk about all those things, like how is your diet, how's your nutrition, how's your appetite? Are you eating a couple meals a day? Or are you eating
Right.
once a day? Or you not eating at all? So all of those things are definitely important. So if somebody got questions for you later or just want tips or recommendations on questions they should ask their primary care, or hey, do you suggest a primary care? You have a resource list. Where can they find you to get that information?
I will shoot you a list of some of the providers that I've had somebody pull together for me. I didn't think about that till you just brought that up, but I have recently been pulling that together. Um, and it was a list put together of Black providers in the region. It, it's missing a lot of them, but it was a start, and I was able to give that as some assistance to some folks that have asked. So I will tag that on to you so you can post that later if that's okay.
Sure, no, definitely, man, because I want people to at least have the insight, whether it's real time or something that they can always go back to and say, hey, I remember seeing this or I heard
Yeah.
about this at least, and then they can just hit one of us up. So if somebody have a specific question for you, do you have a website or email address or something like that?
You can refer them to my email.
Okay,
It's either my home or my work when it's fine. I
okay,
always get to them.
yeah,
I get a lot of those. But I want to go back to your point about the GI tract and stress.
sure.
Think about there hasn't been one college student that hasn't had mouth ulcers at exam time. They're called aphthous ulcers. That's strictly from stress, from lack of sleep and stress, and they get mouth ulcers from that. And they may not know it until they go to drink some orange juice or some citrus, and they're like, "What in the world?" Stress ulcers can actually bleed all the way from the GI tract to the small intestines. The duodenal ulcers are stress related. The increase in cortisol, which is a steroid hormone that's naturally secreted from stress, can lead to heart attacks and all kinds of major events. So, yes, stress, we know a lot about what it does. And that's that whole mind and body, it goes together. How you handle stress.
Gotcha, man. Listen, I appreciate your time. Definitely appreciate the education, the insight, the tips, the recommendations, all those things. So, I'll definitely have you back so we can go in depth on probably some additional numbers or even the numbers that you mentioned. So I definitely appreciate you, man. Any tips that you want to leave with the people?
Find a primary care. Google it in your area, but you should all have primary care. If you have a job, it makes no sense to not have a primary care if you're paying for that insurance. So start that young, start it early, use the patient portal for communication, and know your numbers.
Know your numbers. That's the big one. So, hey, man, I definitely appreciate you, Dr. Silva. I'll catch you on the next one.
All righty. Thank you.